Okay, so have you ever seen a photo of yourself and thought, wait a minute, that's not exactly how I look when I look in the mirror? And if it's a selfie, you definitely aren't wrong. The images, of course, are extremely popular in the past, decade or so, but is it really healthy for us to be looking at those and judging that as how we look? This morning, we're taking a look at the link between selfies and surgery. Selfie. It's a term that popped up several years ago and just hasn't lost its steam. From Hollywood red carpets all the way to local voting precincts. People everywhere are snapping selfies. There are even selfie sticks, but those selfies aren't exactly telling the truth. According to a report in the Journal of American Medical Association Facial Plastic Surgery, a selfie taken from about 12 inches from the face makes the nose base look like it's 30% wider and the tip 7% wider. Now compare that to a standard picture taken at a distance of 5 feet away, where facial features are shown in better proportion. So are selfies contributing to unhealthy body image? Doctors at Charlotte Plastic Surgery say yes, and they are not alone. Last year, 55% of plastic surgeons say their patients asked for surgery to help their faces look better in selfies. That is up from 13% in 2016. Okay, that makes my heart sad. We talked about the distortion of the nose in the story, but a big trend right now in facial cosmetic surgery is lip injections. We're going to talk about that in just a second. But joining me at the table is Dr. Jack Shire of Charlotte Plastic Surgery. Good morning. How are you?
Doing great. Thanks for having me.
Thanks for coming in. You're the newest guy at the practice, they say.
Yep, just joined back in September, so I'm really happy to be in Charlotte.
Well, we're happy to have you. Okay, let's talk about... First of all, let's talk about this selfie thing, because it's a distorted sort of image that we're getting of ourselves, isn't it? But you're probably hearing that, like people come in and they're spending a lot more time looking at their own faces than they used to.
I think that's pretty correct to say. People come in with pictures of celebrities and they always ask, you know, what do they have done or how can it look like this? And I do see it as a growing trend. But it's something that, you know, we have to acknowledge is there.
Yeah, absolutely. And we talked about lip injections and how popular those are. There was an article in Page 6 about how so many actresses are just starting to look alike because they're all getting the same. But what is it about lip injections that's making it become so much more popular?
Well, injections in general become more popular, and we have a lot of patients coming in asking about lip injections in particular. And I think one of the most important things to talk about before we talk about the lips themselves is how to evaluate patients into what kind of look they're trying to achieve, because if you over-inject the lips, you can achieve somewhat of an artificial, unnatural appearance, and I don't think every person is looking for that. In our practice, we're trying to give them a look that's more natural and is more harmonious with the rest of their face.
Yeah, what kinds of questions do you need to ask yourself before, if I were to come into your office, what do I need to be sort of self-reflecting on first before I even come to see you?
Well, I think the first thing to always make sure is you're with an experienced injector, you know, someone that's had training and has done this numerous times. And that's one of the first questions anybody should ask. Some of the other questions that people want to know is what kind of fillers we're using, and, you know, the downtime for the procedure itself.
Well, I know you all sent over some pictures of some of the different options that people have, and I think we have some before and after shots. So let's look at the first one, and you can kind of talk us through what this one is.
So this is a younger patient who has plenty of lip volume, but she just needs to accentuate the highlights of her lip, the upper border. And for these patients, you can just use a small amount of filler and get a great result. So
that, I mean, how many visits to the office would that take? Is that just a one-visit thing? And what's the downtime after something like that?
That is a one visit, and usually the downtime is pretty minimal. The most common side effects we see are bruising and swelling, and that usually resolves over a couple days.
Does it hurt?
It can be uncomfortable, but to minimize that or make it, you know, seamless and painless, we use a numbing cream. And for those patients that need more comfort, we can also do a dental block.
Okay, and now let's look at the next one, and you can tell us what this is all about.
And this is a patient who needs not only volume, but a little more definition as well. And for these patients, we can highlight, like we talked about, the lip borders, add a little volume. And these are common complaints that we see in this age group with those very fine lines in the upper lip. And what we can do is use a very thin filler and inject those, and you can see the kind of result you can get with just fillers there.
That's a huge difference, because I know we all, as we get older, we all sort of start to worry about that, and there's only so much that lip liner can do. So is that one of the more common things that you see?
It is. A lot of people are asking about that.
Well, if people are coming in for any, we have about 30 seconds left, but if people are coming in for any sort of procedure, how much work do they need to do before they get into the office as far as as if you are taking care of your skin properly, or if you're coming in for any sort of weight loss, anything, you want to make sure you're dieting right. Is that an important piece of the puzzle?
Very much so. You always want to take care of your body first, and that's the most important priority before undergoing any procedure.
Well, we have a list of 4 things to keep in mind before we come in to see you. Remind everyone where your offices are as we look at the list. Of course, your treatment plan should align with your face, which is what you said. Results should be natural. I know you all pride yourselves on that. A trained professional, because we've seen people go to these like filler parties and their faces get all messed up. That's not good. And then ask questions. Where can people find you guys?
We're on Randolph Road, and we also have an office down in Ballantyne.
Well, there you go. Dr. Shire, thanks for coming in. We appreciate it.
Yeah, thank you for having me. It's been a pleasure.
If you stick around long enough, you might get lobster too. Chris, over